Good morning. So, in the last part of the fibrinolytic drugs and antithrombotic drugs, we are going to discuss the uses of this particular drug. Now, the uses of the fibrinolytics, they are used into the acute myocardial infarction. Clear? They are used into the acute myocardial infarction. They are the alternative first line approach into emergency that is the percussionary coronary intervention with the stent placement. So here it is important. Next is deep vein thrombosis in case of the leg, pelvis, shoulder. You can say that in the deep vein thrombosis it is very useful. Almost 30% of the patient can be treated with this type of the drug. Clear? This drug also useful to reduce the pain, swelling. Clear? Pain and swelling also. Next is pulmonary embolism. Now, fibrinolytic therapy is indicated in the large and life-threatening condition. So, in the large and life-threatening condition of due to the pulmonary embolism, these drugs can be used. Next is peripheral arterial occlusion. Now, fibrinolytics recanalize 40% of the limb artery occlusion, especially those treated within 74 hours. Now, fibrinolytics have no role into the chronic peripheral vascular disease. They do not have any role into the chronic peripheral vascular disease. Next is stroke. Thrombolytic therapy in ischemic stroke is controversial. Possibility of improved neurological outcome is to be balanced with the risks and intracranial hemorrhage. So, in such condition also, in the stroke condition also, these drugs are very useful. Now, some of the contraindication with the thrombolytic therapy like intracranial hemorrhage, ischemic stroke for past 3 months, head injury in the past 3 months, intracranial tumor, vascular abnormality, active bleeding, other bleeding disorder, peptic ulcer, esophageal varices, any wound or recent fracture or the tooth extraction, surgery within 3 weeks, uncontrolled hypertension, pregnancy. So in such cases, thrombolytic therapy should be avoided because it may cause the contraindication. Now, indication of the platelet medication, antiplatelet medication. So acute coronary syndrome, it can be used. Then post percutaneous coronary intervention with stenting, already we have discussed it. It can be used. Mechanical heart valve in combination with the warfarin, acute ischemic stroke, stable angina. Then you can say that device closure of an atrial septal defect, post percutaneous innervation, post coronary artery bypass grafting surgery, essential thrombocytosis, prevention of the colon cancer, coronary artery disease. Then you can say that inflammation in the or swelling of the blood vessels throughout the body, that is known as a Kawasaki disease, acute rheumatic condition, acute pericarditis, arterial fibrillation, and venous thromboembolism. So in such condition, these are the antiplatelet drugs can be used. Clear? So you should go through all those things, and if you have any doubt, we can discuss further. You can go through this reference also.